And on their own figures, you would need to treat 440 women with folic acid to prevent one neural tube defects. 439 women will not benefit. Yet the number needed to harm, 1 in 50 women will suffer a lost pregnancy. This is what their data shows as a consequence of taking folic acid. So you've got 9 times as much harm as benefit.
That's really why we're writing to these MPs, because as we say, when we were at medical school, we probably weren't really made aware of the difference between folate and folic acid.
Welcome to the UK Medical Freedom Alliance. We are the most recognised and respected organisation campaigning for your right to informed consent, bodily autonomy and medical choice. We are the voice of ethical medicine.
Well, hello everybody. Welcome along to another medical ethics report from the UK Medical Freedom Alliance. And this is another special one because this is one that sort of instigates a conversation that we really need to have and bring everyone up to date. My guests today are our CEO, of course, Dr. Liz Evans from UKMFA, and Dr. Ros Jones, retired paediatrician. And well, it says here, Ros, an active health advocacy and research team member. I think that's a bit of an understatement, to say the least, isn't it?
Right. Busy.
So we're talking about this joint open letter that HART, the Health Advocacy and Research Team, and UK Medical Freedom Alliance wrote on the 26th of June 2026. And that was written to the Right Honourable James Murray MP, Secretary of State for Health and Social Care. Well, he was then. I don't know who is doing it right this moment. That's probably changed. And Sharon Hodgson MP, Parliamentary Under Secretary of State for Public Health and Prevention, and also linked to Department for Health and Social Care. And a response was received on the 24th of July 2026, so about 1 month later. So in order to get the conversation going, before I start, I just want to make sure that everybody please just do like and subscribe these videos. It really helps us to get the message out there. All of our platforms where our content is listed at the bottom of your screen right now. And in the corner, top right-hand side, is a QR code that you can use, and that will give you a way to go through to our area for donations, which is very, very helpful. You can buy us a coffee or donate monthly, whichever you feel is good for you. If you're not a QR person, many aren't, then in the description you'll find the standard link. So without further ado, I think I'm now going to hand straight over to you, Dr. Liz Evans, to make the introductions more solid.
Okay, brilliant. Thanks so much, Ian. And I'm absolutely delighted that Ros has been able to join us today. Our campaign to oppose the fortification of flour with folic acid was kicked off with a really incredible interview with Dr. Claire Craig, who has kind of spearheaded this campaign in the UK. So that you can find that on our Substack. That was done probably a month, 6 weeks ago. And she really laid it out. She'd done a huge deep dive into the research, the clinical trials, the supposed safety studies that were supporting, that the government would claim supports their fortification of flour, and had basically completely blown it apart. So that was part one. So since then, as Ian said, we have written an open letter and received a response. But in case anyone hasn't been following this, I just want to give people very brief background. So the UK recently passed an amendment to the bread and flour regulations to mandate the fortification of non-wholemeal flour with the synthetic drug folic acid, which violates informed consent and restricts consumer choice, which is why we are concerned about it. Now, natural folate is a fundamental bioavailable nutrient which is found in whole foods. But this is not the same as synthetic folic acid, which behaves entirely differently in the human body. It can present serious health risks laid out by Claire, and it floods the bloodstream and blocks key brain receptors. Now, this amendment was passed in November 2024, which kind of went under the radar. This is not a widely known fact. And it basically places a legal requirement on millers and flour producers to add folic acid to non-wholemeal wheat flour, and comes into full effect at the end of this year. The only exceptions are whole wheat flour, flour produced by small mills, that could be a UK or international small mill, or flour used to make communion wafers, matzos, gluten or starch. So that's your sort of the background to this discussion. So the letter that Ian mentioned that Ros, as co-chair of HART, Claire Craig and I put together to James Murray, I'm just going to bring up on the screen, and I'm just going to ask Ros to talk about what we were saying to him and what we wanted to him to do, what we were trying to achieve by this letter. So I'll let you talk while I try and find this.
Right. Thanks, Liz. I think the main thing that we wanted to bring to their attention was that it is actually illegal. There's a nice quote there from the 1875 Parliament made it a criminal offence to adulterate flour. Sales of Food and Drugs Act of that year addressed a scandal that had been building for decades, where bakers were bulking out their bread with alum and chalk and plaster of Paris. So this goes back a long way, that people were adding rubbish to bread. But since then, we were very highly regulated, and this was made illegal. You had to just have flour in your bread, and flour in your flour. That's all flour was. But the argument that the government are using is that they've started supplementing flour for quite a long time now. There is added calcium and I think other vitamin
Thiamine,
B,
I think.
Thiamine, and also iron is in some things. Like if you take cereals, breakfast cereals and so on, have a lot of additives in them. So this is just one other additive. But what they haven't really got across is the purpose of it is very simple. And they've been honest in their reply. The purpose of this is that folic acid, and this is, as Liz has said in her preamble, is a drug. It's not a naturally occurring vitamin. That's folate. So folic acid was first tried in women who'd had a baby with a neural tube defect. That's either anencephaly, where the brain hasn't really formed properly at all, or spina bifida. And that the anencephaly is always fatal, but spina bifida can lead to, significant long-term disability. And women who'd had one baby with this were at increased risk for a second affected child. So then they did a study with high-dose folic acid, 5 milligrams a day, and it was very effective. And they did not see recurrence in the treated group, where they had seen, I think it's about 1 in 8 risk for a subsequent pregnancy in the untreated group. So that all sounded great. And there were several studies replicated this. And this is back in the 1970s or 80s, I think. But then there was one study done from Hungary where they looked at giving it to all women who might want to get pregnant. So at a much lower dose. And these are low-risk women, not high-risk women who are known to have a family history or predisposition to having babies with this condition. And they said that it was effective, but there's actually quite some doubt in that, because if you look at the study, they caused, there were about, for every one baby that didn't have a neural tube defect, there were 9 miscarriages. So actually, in terms of total successful pregnancy outcome, it wasn't great at all. But that was that. And since then, I think it's been widely advised, and at least half of women trying to get pregnant would be taking a folic acid supplement for, a couple of months before they started trying to get pregnant and going on through the pregnancy. So maybe for a total of 18 months of time. But of course, some people get pregnant by accident, or they weren't planning to get pregnant, or even the ones who thought they might get pregnant hadn't got round to getting any of these supplements. And you have to take them really before you know, or in that first few days, because the brain tube, the neural tube is formed very early in embryology, sort of after about 4 to 5 weeks. So the whole of this mandate is in order to prevent another perhaps 25 children with spina bifida being born each year. Yeah. And for that, they are proposing giving the entire population folic acid in their flour. And this includes half the men, half the population who are men. They can't benefit from not having a pregnancy with a neural tube defect. It also includes all children who also aren't going to benefit, and all postmenopausal women. But even if you take women of childbearing years, obviously most of them are not going to be pregnant every year. And once this is in this flour, I think we can assume we will all be receiving it till our dying day. So we're not just talking about the safety studies. They were quite limited, but there were some, and I'll come back to those. But we're talking about increased cancer risk, all sorts of things, which might be not very likely if you only took it for 15 months or 18 months. But if you actually took it for 30 years, we have no idea. And it is a drug, and it is not. We don't know what dose people will achieve because they'll have it in their cornflakes, they'll have it in their bread and sandwiches and cakes. And then if they're wanting to get pregnant, they're still told to take the supplement. So by the time they've taken this lot, they are going to be consuming well above the upper limit that's recommended.
Brilliant.
So I think, Liz, in there, you've covered about the 9 babies who died for each neural tube prevented. And the risk, as we say, outweighs the benefit for the majority because obviously there is no benefit for the majority. But the particular things I think we also raised in the letter was this concern that they're within the NHS guideline currently. If you look up in the formulary, and I think you've got a picture of that somewhere, Liz,
let me pull that up.
The actual recommendations for who shouldn't take folic acid. And there are a significant number of situations where there it is for GPs. If you're going to give a prescription to somebody for folic acid, here you are. Who can take it, and that's good.
So
and
this
then
is
who
your
should
NHS
not take
site
it.
here. Yeah, so here's the NHS site, just so that we can prove that we're not making this up. So it goes through all of the different so there are side effects from folic acid, which of course, is not being mentioned. Bloating, flatulence, nausea, loss of appetite. And who can and cannot take folic acid. So this is what Ros was referring to. He said, most adults and children over 12 months can take folic acid on its own. It's not suitable for everyone. For example, it may not be suitable if A, you've had an allergic reaction to folic acid or other ingredient used in the medicine. If you have vitamin B12 deficiency anemia or pernicious anemia, which is an autoimmune condition, or you have a coronary stent, or, unbelievably, if you have cancer. Now, think about the number of people, the percentage of the population that are in at least one of these groups, if not more. And yet, so they've been advised by the NHS not to take folic acid, and now they are going to be taking it, probably unknown. Most people will not even realise they're taking significant doses, depending on their diet, in their everyday food.
Can I just ask quickly, if you're going into a restaurant or a tea room or anywhere like that, a cafe, and you're ordering a sandwich or a scone or whatever, how are you going to know whether or not they've used flour that's got this folic acid in there?
Well, I think you can assume after December you will know that they will, because it'll be mandatory. So you have to assume that they will. But otherwise, you wouldn't know. And I think it's interesting. We'll talk about their reply in a minute as well, because I think they cover some of this in their reply.
Yes. So basically, just to summarise our letter, we went into the data from the trials. Claire did a really deep dive, and she actually showed the safety issues. She also showed that the safety data had relied on animal studies. In animals, I think it was rats, that don't translate to human biology because they have a different set of enzymes which break down the folic acid far faster in rats than they would in humans. So we told him what the dangers were to public health, and we laid out their flawed rationale, their lack of safety studies. And we also said it violates medical ethics because it's unethical to seek to mass medicate the UK public by adding a drug to a staple food. I mean, that completely violates informed consent because most people don't know about it. People are not being told the risks and benefits. And there's a lot of people who simply, because of their diet, will not be able to opt out of this. And
if I go for a blood test and they come back with a folate level, this synthetic folic acid, will that register as folate in the system?
Yes, it will. It was interesting. There was a study from Brazil where they started fortifying flour, and they found that the population a year later, I can't remember precisely, but almost half the population landed up with folate levels that were, or would have been the previous year, considered to be above the upper limit of normal. So it works. It pushes your folate up. But what Liz mentioned briefly was that it's not very useful because you've got to metabolize the folic acid into folate, but it does it quite slowly. And in the meanwhile, you will have a lot of folic acid circulating, which they're not measuring. They'll measure the folate, which will have gone up because you're taking gallons of folic acid. But in the meanwhile, you'll also have circulating unmetabolized folic acid. And that also binds onto the folate receptors. So you could land up in the situation where, because you've taken a lot of folic acid, although you've got adequate amounts of folate on the measured blood tests, it's not actually bioavailable because the receptor has been blocked with a load of synthetic folic acid. It doesn't even make scientific sense as a mode of supplement. And I think there was one group that wasn't on that NHS list. It's quite comprehensive, that NHS list of who shouldn't take it. But there is also a group which Claire's mentioned is about 25% of the population have a genetic variant which makes them slow metabolizers of folic acid. Now, as Liz said, we metabolize folic acid apparently about 50 times more slowly than rats, and rats were used for all this safety data. So the rats, it looks brilliant because they just changed it quickly to folate and then used it. And humans can't do that. So they'll have hours and hours after they've taken this folic acid load where it's swilling around as folic acid. And if you've got one of those defects, it's going to be even worse. Yeah.
Well, I live with genetic hemochromatosis.
Yeah.
And I believe that folate is one of the things they report on when they come back to me with my hemoglobin levels and my ferritin levels.
Yes.
So I wonder how that would affect me.
Yes,
Because I don't know whether that's a negative effect or not, but I'd love to find out.
Yeah, I think it's rather important that you should. And I've seen nothing to mention any other genetic conditions. But just looking at the B12, it's if you've got borderline B12 deficiency. Interestingly enough, we should talk about their reply, because if we talk about their reply next, then I'll talk about another letter we're writing after their reply. So I don't want to jump the gun.
Yeah, so just to finish off what we actually asked it. So we also pointed out that you get a completely uncontrolled dose. That's also what Ros mentioned. So you could get someone with 1,000 times the intake of folic acid of somebody else. And that's, again, unethical. You can't just medicate in that way. That's not safe. So we urged him to repeal the amendment. Now, we were really shocked, actually, because we've written a lot of letters to government, haven't we, Ros? And we don't often get replies. But only a month later, the 24th of July, we did get a reply. Now, that was from an unnamed, quotes, correspondence officer at the Department of Health and Social Care. Now, it was a very disappointing response. They actually failed to meaningfully address any of our points, which we had laid out really clearly. And they simply just ended up reiterating their argument that adding folic acid will reduce the risk of neural tube defects for pregnant women, despite the fact that we had actually shown that was only a tiny part of the picture. And what if you end up killing more babies than you save neural tube defects? And they also claimed that evidence reviews, whatever they are, and modelling studies have established appropriate levels and safety. And people can always avoid ingestion of folic acid if they choose wholemeal flour products. So I'm just going to pull up that letter and I'll go through it point by point with Ros and just ask for her response on that. So hang on, here we go. So the first thing they said, the primary objective of mandatory fortification is to increase folic acid intake amongst women of childbearing age, thereby improving blood folate levels and reducing the risk of neural tube defects during pregnancy. So they're just replying by almost like just going off on their own tangent again and not engaging with us. But Ros, we have always given, or for a long time, folic acid to pregnant women. They've always had that option, haven't they? That's a sensible way to have informed consent.
Yeah, it's been around for 40 years or more, I would think. Yeah. Certainly 30 years.
So that is already done. And as you say, they are not going to be told now, don't bother to take your supplements. So they're going to be supplementing on top of supplementing, which can't be good. as you say, this drug is going to go to all men, all women, postmenopausal women, women of childbearing age who aren't trying to get pregnant. How many people really have unplanned pregnancies? I can't imagine it's the majority. I would say it's the minority in any given year. And obviously then, even for those women who are being offered sort of prenatal folic acid, if they're planning a pregnancy, they aren't being given the key numbers, are they, to have informed consent? Because you've got two, Claire's come up with this, the number needed to treat and the number needed to harm. So she's looked through this Hungarian trial, which is sort of the key bit of evidence that they're using to justify this. And on their own figures, you would need to treat 440 women with folic acid to prevent one neural tube defect. So 439 women will not benefit. Yet the number needed to harm, 1 in 50 women will suffer a lost pregnancy. This is what their data shows as a consequence of taking folic acid. So you've got 9 times as much harm as benefit. So that's a really important thing, which I certainly didn't know when I took folic acid in all my pregnancies. And then we move on to the decision to fortify this is how they're justifying it. It has a long history. It was recommended by a scientific advisory committee on nutrition after an extensive review of the evidence. It's been subject to multiple public health consultations. They have considered the potential impact on adversely affected groups. So they are acknowledging that there could be an impact, some harm. So that is actually within this letter. But they ensure that the policy addresses concerns related to the health, equity and accessibility for all. And they justify it by saying it's been adopted in more than 60 countries worldwide. So does all this sort of argument reassure you, Ros?
Well, no, and I think it's very interesting that they said it was recommended in 2006. That committee, I believe, had quite some pharmaceutical industry input, you won't be surprised to know. Mm-hmm. And also, at the end of that committee's recommendations, the Department of Health said no. So it's to say it's got a long history is like saying mRNA vaccines have got a long history. They've got a long history of failure. They've not got a long history of success. So this has had a history of being turned down because it was deemed to be unnecessary. They were very clear in 2006 that it was unnecessary, that there was good folic acid, good folate intake in the general public. We were not folate deficient as a nation, and we didn't need this. So yet further up the letter, they did say something. They said very much about it for pregnancy and reducing neural tube defects. But they also said it would be good for the general health of the public, improve their folate levels. But there's nothing to suggest that our diets are deficient in folate. Mm-hmm. So it doesn't reassure me at all. No. And I think their idea that it'll all be, people can choose not to, is again, you were asking if you go into a restaurant. I mean, one of the articles that Claire's written up, because there's a whole series of articles, we can put a link at the end, on the HART website. And one of them, for example, she must have taken some time, gone off into the supermarket and got pictures of bread and so on, lots of different pies and, with their folic acid, and they're all at it all. I mean, lots of them are adding it, even when it's not compulsory. Mm-hmm. So it's coming in by the back door, and then you make it compulsory and say, well, you were taking it anyway and you didn't mind. But I think, when particularly you come to this thing about prostate cancer, there was somebody's done a meta-analysis of 10 of the randomized trials. So this isn't just observational data. This is randomized trial data. And the prostate cancer risk rose by 24%. Well, that's not 2%. That's 24% increase in prostate cancer, which is one of the commoner cancers in the male half of the population, the half that don't need this drug by any stretch of the imagination. And I think if you told blokes that you're fine to take this flower to prevent the pregnancy you're not having a defect that you could have prevented anyway if you were having the pregnancy by taking this supplement yourself for a year, but instead you're going to take this every year and you're going to have an increased risk of prostate cancer, I don't think most people would want it, would they? But it's not sold like that. It's just sold as, for the greater good. It's a tiny inconvenience. It won't actually flavour, it won't make it taste nasty. It's very easy. I think the last health minister said something about it being, we're baking health into our bread. I mean, really,
And yet, of course,
and also the fact it's going in. Yeah, go on.
The Europeans would not do this to their food. 100%.
Well, it's interesting because something's just come up. Ireland have now got a consultation that has just started. And the reason Ireland have got a consultation is, where do you think they get their flour from? They get 70% of their flour from the UK. So in effect, if we're told it's mandatory, it's going to be mandatory on imported flour to Britain after December. But in theory, it shouldn't be mandatory on exported flour. But on the other hand, if you're a miller and you've put it in, you're not going to want to do separate for a different market. So in effect, it's going to be there. So they're now doing a consultation. But of course, it's in the WHO guidance. They are recommending it. So Australia have got it, and the Canada and the US and, quite a number of countries. So I don't think the Europeans will be far behind. And it's all on some Agenda 2030, which is about, I think, it's called Sustainable Development Goals or something, but it's about equity, diversity, equity and access. And so poor countries may be having more neural tube defects because they haven't got the wonders of having this chemical in their diet. So everybody's got to have it. The whole thing is just crazy, I think.
Yeah, and so they obviously think, this correspondence officer, and I feel that's quite disappointing, because we did write directly to the minister, but they won't put their name to these things, and we can't even deal with an individual. And it's no reassurance to say that added vitamins and minerals must be added in the flour ingredient list, and people can easily identify products that are suitable for them, because when it comes to processed foods, people cannot, it's going to be, if you have a diet of processed foods, it's going to be very hard to avoid it. And of course, cheaper foods, people are in a cost of living crisis. People are trying to save money where they can, trying to get, cheaper foods are going to be far more likely to contain white flour. As you say, people, the millers are going to even be adding it to wholemeal, even though they don't have to. There'll be some who do, some who don't. I think you're going to end up in a situation where poorer people who don't have the sort of the luxury of being able to go out into a nice supermarket, check everything, cook everything from scratch, they're going to have higher exposure, and they're going to have a much increased risk of side effects. I mean, this is...
If you travel regularly like I do, and you're going through airports and you want something quick to eat, so you run into Boots, you grab a sandwich or a pie off the counter. Yeah. Or you go into the pub and get a meal served to you, a pie and chips or wherever it might be, because you want something quick to eat. You're not going to have time to question whether or not this has got folic acid in it.
Yeah.
And the chances are you're going to get it anyway. And people that work every single day of the week up in London or wherever, every lunchtime they're popping down to their local cafe or Greg's or whatever again. They're not thinking about what they're ordering. They just see something that looks tasty to them, so they just buy it. There's not going to be labels on the sausage rolls in the hot counter saying, "Oh, by the way, they contain folic acid."
Yeah.
They're just not going to do that, are they?
No,
but it will be probably on the packaging. If you buy a pre-wrapped one, you'll probably find it will say folic acid. Interestingly enough, the question is where we go from here.
Yes.
And I think we should put into the programme notes that there is a government parliamentary petition in progress, and it's already had a reply when you get the 10,000 signatures, but it's now up to almost
48,000 this morning.
And if it gets to 100,000, there has to be a debate. But the other thing that we thought we should do is write to the dozen or so MPs who are medically qualified and see if they would ask some questions. I know Esther McVeigh's already asked a question, but she got a sort of non-response. So we're just drawing up that open letter. So if people are interested in signing that would be, a possibility. But interestingly, so far, I've been collecting names from, a group of medics that I've been involved with. And of the 70 people who've signed so far, 2 of them are people who are personally not able to take folic acid. It's quite interesting. So that's quite, not a tiny proportion. So 1 in 35 effectively. And one of them, it's interesting, she's a GP who's had some cardiac stents. No, so she's not a GP, she's a pharmacist who's had some cardiac stents. So she said it's a nightmare. She said, in effect, I've given up bread but she said, I like an occasional treat, but if she gets anything, a cake or biscuits, everything, she's got to keep looking down the labels. And then I said to her, well, out of curiosity, when you had your stents put in, did they tell you about this? Or do you just know about this because you're a pharmacist? And she said, oh, no, I just found out about it. Nobody's mentioned it at all. So she's had cardiac stents put in, but maybe not this year, presumably. I'm guessing she might have had cardiac stents put in a while ago. But that guidance from the NHS about not taking folic acid has always been there. So, well, not always, but, it's been there for a while, and she wasn't told that she shouldn't take it. Now, the other one was even more worrying, and she's a woman whose grandmother, I think, or her aunt, I think her grandmother, landed up in a wheelchair with severe combined degeneration of the cord, where you get a severe peripheral nerve damage and so on from B12 deficiency. And what she'd got some mild B12 and then was put on some folic acid without them realising that she got subclinical B12 deficiency. And again, it's listed as one of the conditions. You mustn't take folic acid if you think you might be B12 deficient. But how are you meant to know you might be B12?
People are. If you talk to functional medics, way more people than you think are subclinically or clinically B12 deficient.
Yes. So she got tipped into a severe neurological event by taking folic acid. And they've looked at the genetics within the family, and this doctor who was signing the letter and 5 of her family members have all turned out to have this genetic variation that is mentioned in one of the papers, which makes you a slow metabolizer. So it wasn't just that she had B12 deficiency, but she also was a slow metabolizer. And so they have definitely, and this woman has written to her MP, and then they literally got a reply rather like we did, just the usual, oh, well, it's all great sort of reply. But she wrote back and said, look, it's all very well, but you haven't answered my questions. What am I meant to do when I've been told medically I must never take this product? And it's in everything. And she got a much better letter back from him then, quite a helpful letter saying, no, I can see that's a real problem. I'm not aware of what they're doing to address that, and I'll ask some questions.
And what about those people that don't know that they shouldn't be taking folic acid? And I wonder how many MPs don't know that they shouldn't be taking it. That might be an interesting number.
Yeah. And I think, well, that's really why we're writing to these MPs, because as we said, when we were at medical school, we probably weren't really made aware of the difference between folate and folic acid.
No.
I don't think until this has come up that I would have twigged that it had such different biological effects and mechanisms.
I mean, I think doctors are very poorly educated in nutrition. And actually, the more, I've looked into this is a really complex field that doctors are not well trained to even comment on without some extra research, because it's not part of our training. And, I think this is part of the problem. Everyone thinks this sounds like a great idea. You want to just do something for the greater good that's easy and quick and simple, but actually it's missing some really key points. And I think that was a really salutary tale that you told about the person who signed the letter. So this is a really important issue. I think people need to educate themselves on it. We at UKMFA, we're about to launch a campaign page on this where you can get all the resources. We're going to link to all the HART articles. Claire and Ros have been working really hard doing some fantastic articles explaining all the different aspects. We'll put up the letter that we wrote and the response. Ros's letter, I'm sure, will go up in due course somewhere online so people can see what we're sending to MPs with health qualifications. We'll put a link to the petition and a link to any sort of video resources that can help people to educate themselves. And we really need to be lobbying our MPs, because this is just totally unacceptable that it was recognised 200 years ago or whenever that it's not appropriate to be poisoning and adulterating our flour. That is such a key part of a staple diet. We cannot be adding things to it and adulterating it. So thank you so much for joining us, Ros. I think
Oh,
we've
thank
probably
you.
covered everything, haven't we?
I think we have, yeah. Thank you very much for inviting me along.
Right.
And yeah, do sign the petition, anybody.
Yes, please do.
Right. Well, thank you very much, and we'll wrap up now and get this circulated as soon as possible, and continue the fight. Thanks ever so much.
Brilliant.
Thank you.
Thanks, Ian. Bye.
Bye. Bye.